you're joining us right now, we are just getting our second conversation started for this morning, and we're talking all about a great new initiative, and we're going to be learning about a new dialysis clinic which is opening up in the southern region, and we're here to talk all about the Southern WellCare Dialysis Clinic. Joining us for this conversation, we have Carlos Perrera, who is the owner of the Southern WellCare Dialysis Clinic, and we also have joining us via Zoom Sidney Arzu, who is the president of the Belize Wellness Foundation, and Robert Mariano, the mayor of Dangriga town. Good morning.
Mm-hmm.
Morning, guys.
Yes, good morning. Good morning.
All right.
Right. Thanks for joining us. Really interested to hear all about this project. So, Southern WellCare Dialysis Clinic, how did the idea come about, or to establish the clinic?
Well, as everybody knows that I own several other dialysis centers across the country. And this has been a project that we have been looking on from when we opened the center in Cayo, the Ramona Linda. We knew that the next phase of the project was to go down south. It was just for us to look at the timing, the right persons that can work along with us to make the project a reality.
Yeah.
And so we were able to meet the mayor and the diaspora, actually from California, the Wellness Foundation. And in that discussion, we understand that they were looking at the project for a while now, for about 2 or 3 years. And so having looked at their proposal and what they were looking to do, I decided to say, listen, instead of us duplicating efforts, why don't we come together as Belizeans and we put this clinic together, and we can help you all because we have the experience, we have the resources, we represent Fresenius International here in Belize, so we can help you make this out a reality for a clinic, especially with these COVID times and patients having to travel from Dangriga, PG, all the way to Belize City here and to Cayo, or other clinics and so forth across the country. And that's how that initiative came about. And so we're still, Friday, we sit down and we sign the official MOU to make it official from that end.
You know, this initiative of decentralizing the dialysis care that's available. Before, it was mostly in the north and in Belize City that you'd get access to dialysis machines. And what people don't know is that, you know, one, you have to go multiple times a week for several hours. And for someone who lived in the south, for example, that's almost full-time dedicated towards just getting treatment to stay alive.
Correct. And so what we found out in talking to Mr. Arzu, the president of the Belize Wellness Foundation from California, was that there were a lot of Belizean Americans from California who wants to come to Belize and are willing to come to Belize, but are dialysis patients. And one of the issues is that they're all the way down south when they come home. So let me put Mr. Arzu so he can give you all some insight on why they have continued to push this initiative with us and the benefits that it will bring to some Belizean Americans. So, Mr. Arzu can.
Sidney?
Thank you there, Carlos, and thank for Channel 5 for having us on this broadcast this morning to let folks know what we're doing in the United States, particularly in California, for several years. And this whole process of dialysis arises from my cousins and close friend about the same age who had ended end-stage renal disease, and he wanted to come home to basically stay here, either in an extended period of time or basically return home. But he lived down south, and as a result of that, I had to come because there were no dialysis services in the south. His name is Alden. Unfortunately, he passed away earlier this year, so he never will be able to be a fruition of this effort. But looking at our folks down south, the underserved community, I've been since 1917. I reached 2017. Sorry, 2017. I reached out to our very helpful mayor to partner with us to see if we can get this done. And he was very supportive. We have, and we ventured out early this year to make sure that this was going to be a possibility. To add, we have 2 other members, active members of Belizean Wellness Foundation, a nonprofit in the United States. Are members, and they are on dialysis. We have Timothy Flores, who's a retired civil servant from here, and Baltazar, who is also on dialysis, and they want to be able to spend more time home. In fact, Timothy wants to return home from the United States. So our resilience moved forward, and we never gave up. Thanks for Mr. Perrera coming forward, reaching out to us to partner with us. It was the light at the end of the tunnel, and so everybody's excited. We are getting even a lot more support from the United States Belizean community, and we look forward to getting this move to open the center early next year.
Yeah.
And Carlos, perhaps maybe for some people who don't fully understand, can you talk about the based on the nature of dialysis and the treatment, can you talk about the importance of people having access in close proximity to perhaps where they live? Because, I guess some people listening to Sidney just now, they wouldn't understand why it's so important that they need the center physically in or near, Dangriga or the south.
There's several factors. There's the cost factor. There's the transportation, which is put out exhaustion on your body. There's the now new COVID issue that you have to be concerned about. And so those 3 areas of concern is what patients bring to us. I have 9 patients from the south that attends Ramona Linda in Cayo. And it's not their fault. The clinic just doesn't exist in the south. And when they arrive at the clinic, they're exhausted, they're tired. Then from there, after they're sitting there in a chair for 3-4 hours, they have to catch another bus or their private vehicle to again travel all the way down south. There's a patient from Placencia that has to get there by 10 o'clock for us in order for us to dialyze her on a timely basis. Puts a strain on her body. She has to be able to catch a bus at a particular time in Cayo, or she misses to get back home and she has to incur a cost to stay overnight. So the logistics of having that accessibility is important.
Yeah.
And so with that, it's one of the natures of dialysis. Fresenius International, which we represent, have been focused in doing that. I just got back from Guatemala, where we are going to put one of the new 5008 machines in this southern clinic, because it gives better dialysis care as well, but it's a more expensive machine. So it's the quality of care is important, but that has to do with your health and how you are coming mentally to the clinic. And you want to be home away from home. We don't want you to be coming home exhausted and so forth from that. And you need to be able to go back to work and to work as normal. And so the logistics is very important. And so that's why we're taking it closer to home, closer to those patients. And there's a lot of other factors that are there. There are patients who are not on the program that want to do dialysis, but because it's too far. So there's a lot of other factors that putting it in Dangriga, in the south, will help more people and help those who are already traveling and putting themselves at risk.
Let's get Mayor Mariano into the conversation to hear a bit more about how you're assisting in the collaboration.
Yes, thank you very much for inviting me onto the show. I would also like to thank Sid and Carlos for partnering with the Dangriga Town Council and to get us involved. You heard Carlos say it right, that there are so much factors that is affecting our people here in Dangriga, especially those that are having kidney problems. And so we look at the cost. You know, people have to do several fundraising to pay for the cost of dialysis in other districts. Then they have to do fundraising as well for transportation. And for those who can't afford transportation, they have to actually take that, do some punishment to travel on public transport from here to other districts to get their dialysis. The other thing is the COVID, which make them vulnerable, you know, to death if they would catch COVID on the bus. So when Sid came and discussed this matter with me some years ago, well, as soon as he learned that I became mayor, he came back and he discussed the matter with me. And we got Dr. Zab, the ERA rep, involved as well. And so we collaborate together. And so we tag team with them and we're doing all that we can to ensure that this becomes a reality. The other thing is that I also look at is the reality that this will also create employment for Dangriga people, because several people will be employed from Dangriga for sure when it comes to this center.
Now that's a key point there. While employment opportunities are definitely something to look forward to, what about ensuring they're trained?
Let me answer the first question.
Yeah.
The employment aspect is overwhelming. We have put it out there, and in less than a week or 2 weeks, we got over 100 applications.
Wow.
And that ranged from physicians to nurses, registered nurses, staff nurses, technicians, administrators from that end. And that shows the importance of what we bring to the table of employment down south. In regards to the training and so forth, the good thing, because we're Fresenius recognized and Fresenius representation here in Belize, we have that direct connection with Germany, Panama, and Guatemala, where we can communicate with our nurses. The nurses in Ramona Linda, we did Zoom training with them due to COVID when we had launched that particular clinic. The technicians communicate directly. We have some of the same machines at Belize Healthcare Partners. Their technicians communicate with our people in Panama via Zoom when there are issues and so forth. So training is not an issue. They will be fully trained on the machines and so forth in that regard. From the technicians, the nurses, the doctors, and it's not going to be an issue. And most important, we want to give employment to the people down south. We want to give that focus. We're not saying we're closing the doors to anybody who is from outside that area, but as I told the mayor, it's important to educate and to also have the locals feel a representation down south, that this is part of them. This is something that is now a reality for them. So training, because Fresenius recognized, will be doing all of that for them.
How many machines do you plan to have at the center?
We're normally going to be opening up with 10 machines.
Okay.
A little bit larger than the size of the population that we would want to put down there, but we believe that the need is there, the growth will be there, and as we did in Cayo, we have exceeded the needs in Cayo. So even the Cayo clinic, Ramona Linda, we're looking to expand as we speak because of that. So I had anticipated 10 machines there as well. Now we're going to be up above that. So same thing with the south, because remember, we'll be servicing PG as well. We'll be servicing all those areas, Independence from that end, not only Dangriga Tong, and these patients come from all the south.
And looking at the affordability of it.
Well, Marlene, you know that in 2015, when I opened the first outpatient clinic, the first thing that I did for the country was to reduce the price. Where we were paying $600, $800 per session, the price is the same $200 per session across any of the clinics for us, and that is to make it affordable. And that is a price that anybody can ensure that they acquire the service. One of the key things that we're doing, the foundation Sid will explain to you, is that they will also be assisting those patients for those third sessions that the government doesn't pay. Keep in mind that the government pays 2 sessions, and the third is paid by the patient. The foundation is going to see how they can work with us, and we will also give them a discount on that. We're not going to charge them. It's to make it affordable for the people down south, and that's the initiative that we're here for.
Yeah, Sidney, you want to tell us a bit about that fundraising, because even $200 a week is a lot for people who need dialysis.
Well, like what Carlos said originally, was a major issue. I remember when a couple of us to travel here, they had to go to Belize City. In fact, fly to Belize City, which was at least $100 one way. Then they have to pay for a cab, and other expenses of transportation, mode of transportation and assistance. extremely expensive, and they can exhaust their.
Yeah.
The price that others have negotiated is very, very, very fitting with our strategy. Um, we're not offering free dialysis for the public because that would be very, very difficult to manage.
Yeah.
But in collaboration with the government services, we are, as a foundation, we are supporting a discounted rate, something like 50% of the regular cost for people who cannot afford dialysis. We also have members and supporters in the United States who who's been with us to make this possible. We are also making it possible for them to have comfortable and professional international standard dialysis services when they come visit to the United States. So the affordability, I think, is there. I know that the folks in the South, particularly, are very difficult, and with COVID today, employment is a problem, and we will do our best to be able to support them.
Yeah.
And the other part to it that Honorable Mariano can add to it, he wanted the employment opportunity for our people in South Belize as the primary candidates. So we're doing a multitasking here, opportunity and benefit for our people. So I think that it will be well accepted and suit our environment.
Nice. Now, it's called a WellCare Dialysis Clinic. Are there other elements that are being included?
In the center, we'll have the nutritionist on board, you have the
Okay.
nephrologist on board. So it's going to be a well-rounded center. We'll have an isolation center for Hep B, Hep C patients, HIV patients. The only new aspect of it that, as I said, that will be new to any of the other clinics that we have interest in will be that we'll have the brand new 5008 models.
Yeah.
These are new models that Fresenius have brought out, but it's something that we want to bring to be able to illustrate to the government and the Ministry of Health the quality of dialysis that these machines bring. Actually, in Guatemala right now, those 5008 machines are evaluated by the Social Security because that's how it's managed in Guatemala. And they see that the results of dialysis on these the different models are different. And so that's some of the things that we want to bring to Belize, to take dialysis to a different level as opposed to we're using these old 2008 models coming on from the US that are old and refurbished. We want to put the dialysis to another level. One of the members for Belize Wellness Foundation, which I wasn't aware of, attends one of our clinics in Cayo. And Mr. Baltasar, I believe. And when I found out he was a part of the foundation, I said, I recognize that name, you're a patient. And he said, yes. He said, Mr. Perrera, the machines and so forth and the service that is offered in the West is as if I walk into Davita or any of the other centers in the US. And that's where we want to take it, Marlene. We want to take that service to that different level.
Absolutely. And I think just for people who have been trying to figure out a way to get to their treatment, this is going to be such a relief. Transportation costs definitely eliminated or cut down significantly, and also just the amount of time and energy that it takes. Are we still seeing, I know the Ministry of Health program is limited, and one of the challenges with dialysis patients, it's always the same. It's trying to get on the program, but majority of the time it's capped out. Is that still an ongoing challenge that you find with the centers?
Yes, it is still a challenge. The government has a budget to be able to cater to patient needs in that regard. You know that they had changed the program from 3 sessions to 2 sessions to be able to expand the amount of patients that they're doing. I will say that the new government had made some changes and had increased it actually from 88 to 96. We are writing some proposals to the government right now to see how we can even increase that number even further for them to make it even more affordable for the ministry. But the reality will be, Martin, is that at some point in time, the government will have to increase their budget because the cases of renal failure is there and it's increasing. It's unfortunate that we have to monitor it tremendously for the fact that COVID is an issue. We have lost some patients over the last few weeks, not only in our center, in all the centers across this country, because it is one of the underlying conditions that if you have COVID can make it deadly.
Yes.
So we had some patients that passed and we're trying, so accessibility is important, and the ministry is aware that we need to get these patients on the program. They're very cooperative with us on making that happen. I can't say that they're not, but at some point the ministry will have to look at their budget for an expansion in that regard, because the numbers are increasing, but they're working with us. They're working to ensure that patients are on the program, getting on the program, and we ourselves try to help the patients, Martin. What we do is we write to Social Security, we write to certain organizations who may want to sponsor patients in that case.
And there are, you know, I think when you think of the elements in our country, diabetes, if uncontrolled, can lead you to the type of kidney failure, kidney disease that would have you require dialysis treatment. I guess the light at the end of the tunnel is that KHMH is exploring kidney transplants, and they've said they'll be moving in that direction. So for some people, there may be an end.
Correct.
But the long-term goal here, Carlos, if you want to tell us, is being able to ensure that those who need access to this care can get it as close to their home as possible and at a rate that they can afford.
That is the goal, and that will always be the goal in this type of service. It's to make it accessible to those patients closer for many reasons, like I said, we said earlier. So yes, that will be our goal, and that continues to be our goal. You may see not much further expansions after this last one here, but we may do further expansions down the road, for example, going further west and things like that, or even further south with smaller centers. We will be approaching the government to see, because remember, we are only dealing with chronic cases. There are still acute cases that go to the regional hospitals from that end. So we will be putting a proposal to the ministry for putting in machines at the regional hospitals where we can offer acute cases within the hospital, so they have that service. But that's something that we're looking long term as well.
And so the clinic officially opens?
Clinic officially opens in January. We are, as we speak right now, we're doing renovations. I'm importing actually about 30 machines because we're replenishing in different clinics. They will be getting 10 machines down south. And I think by December, we'll be doing some testing, running the water system, which we always have to do. And then by January, we'll be able to cut that ribbon and start offering the service. Because immediately, like I said, 8 or 9 patients from the clinic in Kaya will be transferred. So I'll be transferring them from the Kaya clinic to the
people who are
clinic,
already commuting,
who are already commuting to us right now. So that's very important for them. They're more than happy in that regard.
Well, we are just about out of time for this segment, but we do want to say thank you to everybody for coming in and sharing all about this news. And it's filling a need that's very much there. So we definitely appreciate the work that you're doing, and the foundation, and that you're able to get support from the municipal government. So thank you, gentlemen, for coming in and sharing all about the Southern WellCare Dialysis Clinic.
Thank you as well.
Okay.
Thank you very much.
All right. Stay safe.
Okay.
See you tomorrow.
Appreciate that. And with that, we're going to be taking a very short break, and when we come back, we're going to be talking all about the female under-17 football team and their preparation for the CONCACAF under-17 qualifiers. So we'll be right back, so stay tuned.